obvious symptoms.
Factors that causes the hypertension.
Precaution of the hypertension.
Treatments in hypertension.
Hello everyone, I'm Farah. We are students of S29 Group 5. Today, we will be sharing with you everything you need to know about hypertension. Now, let's look at the chronology of hypertension in Malaysia. We are able to gather the reports of prevalence of hypertension from the National Health and Morbidity Survey (NHMS) from 1996 to 2019. From the report, we are able to find that among adults aged 18 years and above, there is a slight decrease over the years of 2006 until 2019. However, there is a significant increase in the prevalence of hypertension among older adults of age 60 years and above. So we can say that there is an increasing trend of hypertension where the rates increases with age. Furthermore, it is also reported that the prevalence of hypertension was higher in rural areas compared to urban areas. Hypertension, also commonly known as high blood pressure, is a health condition that has been a major global concern for many years. It is the number one cardiovascular risk factor and remains the leading cause of mortality, contributing to an estimated 10.8 million deaths annually. According to World Health Organization (WHO), approximately 1.28 billion adults globally suffer from hypertension, with 46% unaware of their condition. In Malaysia, 1 in 3 adults are affected by hypertension. According to National Health and Morbidity Survey (NHMS) in 2023, approximately 29.2% of Malaysian adults have hypertension. That is roughly 6.7 million individuals, and around 11.9% remains undiagnosed. Fun fact, over 2.3 million Malaysian adults are living with at least 3 non-communicable diseases, NCD, including diabetes, hypertension, high cholesterol, and obesity. Now, let's pass it on to Nusra, shall we?
Hypertension or high blood pressure disease often has no obvious symptoms, which is why it is called as a silent killer. However, in some cases, people may experience symptoms such as headache, dizziness or lightheadedness, blood or double vision, nosebleed, even though it is rare to occur sometimes, shortness of breath, chest pain, which could indicate a more serious condition over time, fatigue, irregular heartbeat, and so on. If blood pressure becomes dangerously high, which is a hypertensive crisis, it can lead to severe symptoms like confusion, severe anxiety, or even loss of consciousness. Therefore, regular blood pressure checks up are important to detect and manage hypertension early.
There are several factors that causes the hypertension. First is unhealthy diet. When we consume high sodium, it can cause the body to retain excess water, thus increasing blood volume and raising our blood pressure. Next, low potassium diet. Potassium is important as it can help balance sodium levels and relax our blood vessels. Lastly, excessive sugar and unhealthy fats, which can lead to weight gain and arterial stiffness. Second, aging. As we aging, blood vessels will lose their elasticity, which will make it harder for them to expand and contract properly. This will lead to increased vascular resistance, causing blood pressure to rise. Next, arteries may accumulate plaque over time. This will narrow the passage for blood flow and forcing the heart to work harder. Lastly, chronic conditions. For example, kidney disease. Chronic kidney disease (CKD) leads to fluid retention, increasing blood volume and pressure. Damaged kidneys produce excess renins, a hormone that can narrow our blood vessels, further raising our blood pressure.
Hello guys, I'm Nurin and I will be talking about the treatments in hypertension.
There are a few medications given to patients with hypertension. One of them is diuretics, which will help the patient's body to remove excess sodium and water in order to reduce their blood pressure. Next is ACE inhibitor, which will help in relaxing body vessels by blocking a hormone that narrows them. Lastly is ARBs, which work similarly to ACE inhibitor but with fewer side effects. A few patients with severe hypertension or special cases will be given an advanced treatments. One of them is renal denervation. Renal denervation is a catheter-based procedure that reduces nerve activity in kidney arteries. These treatments are for patients with resistant hypertension. How does renal denervation work? First of all, a thin catheter is inserted into the femoral artery and guided to the renal arteries. Next, the catheter will emit radiofrequency energy or ultrasound waves to disrupt overactive sympathetic nerves in the kidney arteries. This will reduce nerve activity, leading to lower blood pressure over time. Then, the catheter will be removed and the small incision is closed. Another treatment given to severe hypertension patient is baroreceptor activation therapy. Baroreceptor activation therapy is a device that stimulates the body's natural blood pressure regulation system. For this treatment, firstly, a small pulse generator like a pacemaker is implanted under the skin in the chest. Next, electrodes are attached to the carotid arteries to stimulate baroreceptors. Stimulation signals the brain to relax blood vessel and slow heart rate, reducing blood pressure. This device can be adjusted to control blood pressure levels.
That's all from me. Now, let's pass it on to Dina.
Hello, I'm Yodina. These are the precautions of hypertension. Firstly, by managing our stress, we may feel emotional discomfort when faced with a stressful situation. Our bodies can react by releasing stress hormone into the blood. These hormones make the heart beat faster and raise blood pressure temporarily. By learning how to relax and manage stress, we can improve our emotional and physical health and lower high blood pressure. This can be done by doing an activity and being socially connected with others, listening to music, and meditating. Secondly, by eating a healthy diet. To help manage our blood pressure, we should limit the amount of sodium, which is salt, that we eat, and increase the amount of potassium in our diet. It is also important to eat food that are lower in fat, as well as plenty of fruits, vegetables, and whole grains. Thirdly, by being at a healthy weight. Blood pressure often increases as weight increases. Being overweight also can cause a disrupted breathing while you sleep, a condition called sleep apnea. Sleep apnea further raises blood pressure. If you are overweight or have obesity, losing even a small amount of weight can help lower blood pressure. Despite that, maintaining a healthy weight can reduce our risk for other health problems. Lastly, getting a regular physical activity. For example, regular aerobic exercise. This can help lower high blood pressure. Exercise also can keep elevated blood pressure that is slightly higher than ideal from turning into hypertension. Some examples of aerobic exercise that can help lower blood pressure include walking, jogging, cycling, swimming, and dancing. All from AS School 5. Thank you.